we found a germline variant, which is a prevalence of around 10 to 15% among AML and MDS patients. And we found that this variant, on one hand side, influences prognosis. So patients carrying this variant have an inferior prognosis and do not respond as well as other patients to standard therapy. But we try to dissect the reasons why it predisposes to AML and why it confers inferior prognosis, and saw that one of the reasons is that GFI1 is implicated in DNA repair. So GFI1 is required for DNA repair. And this GFI1-36N variant has a defective DNA repair capacity. So cells cannot repair DNA damages as efficiently as other cells. So this, of course, predisposes to AML development, but also opens the possibility of a targeted and personalized therapy approach. So we found out that certain DNA pathways are affected, and if you target these pathways, and in addition, and if you target these pathways, you can eradicate leukemic cells, whereas at the same time you can save normal cells. So the interesting thing is that this DNA repair capacity is altered nearly exclusively in leukemic cells, but not in normal cells. So normal cells who carry this variant are not defective in their DNA repair capacity, but leukemic cells are defective. We don't know the reasons why it's so much different, but this opens the possibility to target leukemic cells specifically without targeting healthy cells. And we showed in primary mouse cells and primary AML cells from patients, as well as mouse models, that using a targeted approach, you can eradicate leukemic cells, but at the same time sparing healthy cells.